Good morning, good afternoon, good evening, everyone, wherever you are. Welcome to this Yale Center Beijing event on the book, The Masters of Medicine. I'm Carolee Rafferty, the Executive Director of Yale Center Beijing and also Yale College class of 2000. And I'm delighted to have a distant cousin, Dr. Andrew Lam here, a retina surgeon, an award-winning author of the book that we'll be speaking about today, to speak about the history of medicine and how medicine is actually the only winner in wars, which I thought was a very catchy title. A bit of background. Dr. Andrew Lam, he was class of 1998 at Yale College. His major was history. Besides being a retina surgeon, he has authored a number of books, including Saving Sight, an Amazon bestseller about his surgical career, and two novels about the Second World War, one called Two Sons of China and another called Repentance. Before attending medical school, he was at Yale, and his writing has appeared in many publications, including the New York Times, Washington Post, and USA Today. He's currently also an assistant professor at the University of Massachusetts Medical School. I know that he has given this talk to audiences as wide-ranging as academic to the Smithsonian Museum lovers or followers. So I'm very delighted to be welcoming him to this Yale Center Beijing talk. So Andrew, going to you, and please feel free
Sure.
to share your screen. Thank you.
Well,
And
thanks a
for those
lot.
of you, oh, sorry. And for
Go
those
ahead.
of you who can, please feel free to turn on your camera so we can see so Andrew can see who he's interacting with. Thank you.
Sure. Yeah, I'll share my screen in a second. Thanks so much for that kind introduction, and thank you to all for being here and spending some of your Friday evening with me. I love talking about two of my favorite subjects, which are World War II history and medicine. You know, as my day job, as Carol mentioned, I'm a retina surgeon, which means I spend most of my time trying to save sight from serious conditions like retinal detachments and diabetic retinopathy and macular holes and macular degeneration. But anyone who knows me knows that my first love was history, and I'm sure there's many history buffs in the audience here tonight as well. You know, tonight I thought I would just briefly tell you a little bit about how I became an author, because when I left Yale, I didn't think this would ever happen to me. Certainly, I think my English teachers in high school were shocked that I became an author because I wasn't really the most assiduous English student, for example, but I will tell that story. And then I want to really share a couple amazing history stories with you guys, which I think will inspire everyone. So when I went to Yale 25 years ago, it seems like yesterday, but it was quite a while, I guess. I majored in history, and my focus was military history and U.S.-Chinese relations. And my mentor was this professor named Jonathan Spence, who really, in retrospect, changed my life in some ways. He was, I know there's probably a lot of younger people who don't even have any idea who he was, but he was a famous history professor of Chinese history. And he was my mentor, and he was my senior thesis advisor, and I wrote my senior essay on the Flying Tigers, which were, as you probably know, American mercenary pilots who flew for China against Japan during World War II, before Pearl Harbor, actually. And under his influence, I actually did think about going to grad school in history and becoming a history professor. But I also had a father who was a cardiologist, and growing up, I grew up in the central Illinois. And he made you could see he made a really big impact in our community. He was saving lives. Strangers would stop me in the street as a kid and ask me if I was going to be a great doctor like my dad. And so these kind of indelible moments made me realize that being a doctor could be a really fulfilling career. And so I actually went to medical school. But I remember the moment when I said to myself, I wonder if I could become an author. And ironically, it happened in an emergency room in my second year of residency in the middle of the night. I literally remember it was like 2 a.m. And finally, the flow of patients had started to die down. but I couldn't leave. So I was just sitting there at the desk kind of daydreaming, and I had to decide this thought that I am sure has never happened in the history of an emergency room. I thought to myself, it's such a pity I can't share all the stuff I know about World War II in China with people. You know, I had studied this a lot in college, and I really felt like China was like this unmined aspect of World War II that a lot of at least American readers didn't know enough about. You know, they may know a lot about D-Day or Pearl Harbor or Guadalcanal, but they didn't really realize or didn't know about all the American Foreign Service officers and men who went to China. And you know, frankly, they worked with the nationalists, they met with the communists, and all these things that they did in this important theater of the war. But I was kind of like, I want to share this information with people, but I don't have time to write a nonfiction book, you know, because I'm a busy resident. I had 3 little kids. Didn't have time to interview veterans or travel to China. So I kind of was stuck until I thought that night, what if I wrote a novel? You know, let me just start sharing my screen now. You know, a novel is something I could think up anytime. I could think about it going to work. I could think about it when I'm sitting in the ER between patients. You know, I didn't really need to do any reading because I had the information I wanted to share. I watched a lot of war movies, possibly all of them, and I I remember thinking, I'm sure I could think up of an exciting, epic, romantic war story and use that as a way to both educate and entertain. And so that's what I did. I wrote a novel. It took many, many years. I got an agent. I got a book deal, and in 2014, that book came out. And it was very nice. I put a lot of time into it, and it was called Two Sons of China. And at that point, you realize, you know, you've got a literary agent. And when you have an agent, you suddenly spend all your time thinking about what else could I write about, you know, because you now have something very valuable, and that's access, okay? Access to editors and publishers. And I thought to myself, gosh, I'm a very historically minded ophthalmologist. I have a great idea because there are so many great stories of medical discovery in ophthalmology, many of which have to do with World War II. And these are stories of unsung heroes who basically suffered, persevered to make discoveries that changed all their lives and saved sight. And I remember I went to my agent and I said on the phone, I've got a great idea. I want to write a book about ophthalmology's heroes. And there was complete silence. And I I knew this was not good, but I just waited for her to respond. And she finally said very tactfully, you know, I really just don't think this is going to work for us. And I said, why not? And she just said, I think that the general public's just not going to be interested in a book about ophthalmological history. So I was crestfallen, and it took me a little while to get over my disappointment. But I also realized she was right. You know, her job is to make money selling books. She doesn't want to waste her time with a book that's not going to be successful. I guess I shouldn't waste my time writing a book that people aren't going to read. But I wanted so strongly to share these incredible stories with people. I just thought really hard about what I could do to make it more marketable, right? So then I thought, well, what if I blended my personal story as a surgeon in training with the historical story? So I could bring people into the operating room to show them what it's like to try to save sight, or maybe more interestingly, what it's like to come up against terrible complications that we sometimes have and not even know exactly what to do, or sometimes all the options are bad and you just have to choose the least worst one. And that blending of my story is probably what made the book as successful as it was. It was called Saving Sight. It actually got a book deal so fast. It came out before my novel, even though I had written the novel many years before. And ever since Saving Sight came out, people told me, readers, editors, you should do that for all of medicine. You know, you should find all of these unsung medical heroes who nobody knows about, who people who aren't well known but deserve to be. And that I knew that was a good idea, but along the way, I had also been very involved in trying to tell another incredible American story, and that is about the Japanese Americans who fought in World War II in Europe with incredible valor, while some of them had families incarcerated in camps unjustly, like Manzanar at Home, and that was a novel called Repentance that came out in 2019. But, you know, during this time, I was still kind of thinking this idea for a medical history book is going to be a good one. And during the pandemic, I finally had time to start reading about other aspects of medicine. So, I read about cardiology, kind of an homage to my dad, I guess. And I was blown away. I had been a pretty arrogant ophthalmologist. I thought that all the best stories of discovery were in my field. I mean, some of the stories of the things that were invented to save sight had to do with the Battle of Britain and like pilots getting shot down with plexiglass in their eyes, and like that led to the invention of the artificial lens and stuff. And so there's great stories, but cardiology blew me away. I mean, the long-suffering people who risk their own lives sometimes to develop cardiac catheterization or cardiac surgery just was amazing. And then I read about the discovery of insulin and how these four Canadian discoverers hated each other so much. One of them almost refused the Nobel Prize because he was just so incensed that a co-discoverer was also going to get one. He just felt that his contribution had so much like outshined this other guy's. And I realized that these doctors who saved millions of lives were so like guilty of just human fallibility, envy, jealousy, and just like self-interest. And I was just totally hooked. These stories had so much drama, and that is what became the Masters of Medicine. So thanks for listening to just how I became an author, basically. And I'd love to now jump into telling you a couple great stories. These are stories that are about World War II. And my favorite adage is the only winner in war is medicine. That's true, right? So true. And tonight I want to tell you about how a wounded soldier during D-Day helped inaugurate the field of cardiac surgery, because I just think operating on the heart is just such an incredible, miraculous thing. And a second story will be about how a disastrous Luftwaffe bombing raid in Italy led to the first cancer chemotherapy drug, which has changed the lives of so many people. So let's begin. So this first story is about the heart and operating on it. So think about the heart. It's constantly moving. It's buried in the center, deep in the center of the chest behind a wall of ribs. And you can see why, for millennia, the idea of approaching it, exposing it, operating on it, operating inside it was impossible, right? It would take only a truly desperate situation for any surgeon even think about it. It would be insane to think about doing this, right? Well, enter World War II. As you can imagine, the war produced a plethora of these gruesome injuries of a nature that doctors and surgeons had never encountered in civilian life. So there was this one surgeon named Dwight Harkin. He was from Iowa, so a fellow Midwesterner like me, so I knew I would like him when I started reading about him. And he was stationed at an army hospital near London, and he had trained at Harvard Medical School, and he went overseas during the war, and he sometimes encountered these men whose chests had been kind of blown apart by like bomb blasts or shrapnel. And sometimes these men had pieces of metal that had punctured the heart wall, but had plugged the hole that they had made, so that these soldiers were still alive. They were languishing, but they were kind of close to death. They would die if nothing was done, because from slow exsanguination, or sometimes when you have like metal surfaces in the bloodstream, you get blood clots that lead to strokes, and you can die from that. So he wanted to do something to help these young men, but he knew what would happen the second that you pull out the metal from a beating heart. You're going to have incredible bleeding under pressure, right? It's going to be impossible. And, if you've ever, the first time I saw heart surgery, I was like thinking to myself, this is incredible. God did not intend for us to be able to do this. But now you can just watch it on YouTube. So if you've ever watched heart surgery, you know that operating in the heart is literally operating in a hole. And if you have uncontrolled bleeding in that hole, you quickly lose all your visibility, and there's no way you can do anything. So Harkin knew that if he was going to try to do something here, he was going to have to think of a novel way or a new way to operate on or suture the heart. Well, on D-Day, this is June 6, 1944, he actually tried a new method. A soldier was brought to him with a terrible wound. A piece of metal was in his heart, punctured his heart, and was plugging the hole. His idea was to pull out the metal and immediately stick his finger in the hole. It's not that sophisticated, but he thought it was this finger, literally a finger in the dike strategy, might give him enough precious seconds to pass 2 or 3 sutures so he could close the hole. But still very difficult to do in a beating heart. So he decided to proceed. In this patient, he opened the chest, he spread the ribs, he entered the pericardial sac, and he could see the metal bobbing up and down with every beat of the heart. He grabbed it with a clamp and yanked it out and stuck his finger in the hole. And imagine the tension at this moment. You have to understand, nobody to this point had ever done like a premeditated operation on a beating heart before. Okay, again, the heart was inviolate. The surgeon should never approach the heart, was the thinking before this. Though it can't compare with his first try at this, I can tell you sometimes when I'm operating, there are moments of pure stress bordering on panic. This usually is happening when I'm trying to fix a retinal detachment, and the visibility for what I'm trying to do is going badly because the cornea is getting too hazy, which means I got to work faster. But ironically, it's even harder to work faster because I can't see what I'm doing. Or sometimes people will get artificial lenses after cataract surgery and they'll fall into the back of the eye, and I've got to fish them out, and they're lying on the retina, and I'm terrified of damaging the retina by like touching it or manipulating things, and that I'll make things worse. And those are times when my heart is racing and it's quite nerve-wracking. And so, I'm pretty sure Dwight Harkin, knowing how he might have felt, must have had sweat dripping down his brow when he's got his finger inside this soldier's heart. But guess what? It actually seemed to be working. He was able to stem the blood and was able to pass a suture, then another suture, to kind of close this hole. And the only moment of dismay occurred when the third suture went through a finger of his glove, and he found himself sutured to a beating heart. We know this because he wrote a letter to his wife about this operation, this fateful operation, and it was just incredible. So he cut himself free, and believe it or not, the surgery worked. The soldier survived. Amazing, right? An actual strategy and plan to operate on a beating heart. Well, he was a smart guy. He made improvement on his techniques. He said to himself, well, wait a second. What if before I pulled out the metal, I pre-placed a ring of sutures around the metal? That way I could yank out the metal and just pull on the string, and then the hole would just close up fast. Smart, huh? We're just getting started. This guy used his methods and improved them and managed to remove the metal fragments from the hearts of over a dozen soldiers during the war. And only because of World War II and the number of men he encountered with this manner of cardiac wound could he have practiced and improved his technique. So now I'm going to tell you how this changed all our lives for the better. So let's fast forward to after the war. You have to understand that the most common heart disease of that time was something called mitral stenosis, which stemmed often from a common childhood illness called rheumatic fever. So this is the era before antibiotics. Kids would get this thing called rheumatic fever, and they'd get sick, and then they'd recover, and they'd be fine, except that they weren't, because the inflammation that would happen in their bodies from the infection would harm parts of their body, particularly their heart valves. And the mitral valve separates, I don't know if you can see my arrow, the left atrium and the left ventricle. So this is the mitral valve, and blood is supposed to go from the left atrium to the left ventricle and then go out the aorta to the rest of the body. So the job of the mitral valve is, first of all, to allow the blood to pass through it entirely, to empty the left atrium. And then its job is to slam shut so that all the blood gets ejected out the aorta and does not go backwards into the left atrium. Well, the problem is with the scarring and inflammation and tautness and thickening of the mitral valve that can occur over years of inflammation after rheumatic fever, the mitral valve becomes narrowed, and it becomes like a bottleneck. Okay, so what happens with these young people in the prime of their lives, in their 20s and their 30s, they would basically, the blood in their left atrium would not be able to fully empty, and it would just start to back up. And what's behind the left atrium? It's the lungs, because the blood goes from the right side of the heart to the lungs and then the left side of the heart. So these patients would have lungs that would fill up with fluid, fill up with blood. They wouldn't be able to breathe. They'd be coughing up blood all the time, and they would die in the prime of their lives. And so, there were surgeons who dreamed of doing something to help these patients, but what could they do? Well, there were two rival surgeons who dreamed of doing something about this. One was Dwight Harkin, who I told you about from World War II. but another was named Charles Bailey. And Charles Bailey was well known for being incredibly arrogant. Okay. He had a crazy idea to try to treat mitral stenosis. He was from Philadelphia. His idea was to take Harkin's techniques a lot further. He wanted to, first of all, make a purse string suture in the left atrium, then make an intentional incision in the center of that suture, and then stick his finger in the hole. Okay, so that you were familiar with. So now he's dreaming, what could I do with my finger in the heart? Well, what can we do with our fingers? One thing we do is just, we can poke, right? We can poke. And literally, that was his idea. He thought to himself, if I could just poke my finger and maybe ring it around the mitral valve orifice, maybe I could like separate the fibrosed leaflets and make it function better like it used to when it was healthy. The risks of this were enormous and largely unknown. What if his finger disrupted the heart rhythm and caused ventricular fibrillation and death? How would he know how hard to poke or how long to poke, or if he poked enough? He wouldn't. It was just all done blindly. So this is an illustration of what he's trying to do. You know, you can see in this illustration, the surgeon has his finger in the left atrium. It's basically his fingers going into the mitral valve orifice. There's a little purse string suture around his finger. There's a little metal rod that takes the vector of the sutures in the same direction so they can easily be tightened around his finger to limit blood loss and close at the end of the operation. But this is very deceptive, right? Because you can't see any of this. This is, in real life, this thing is moving. It's full of blood. There's blood kind of oozing out everywhere. So, you know, it's a really challenging thing. But of course, he knew that if he did nothing, his patients were going to die. So on November 1945, this is after the war, remember, he operated on a patient who was 37 years old. His name was Walter Stockton. His mitral stenosis was so bad he could barely walk or breathe. He couldn't walk to the end of the driveway to get his newspaper. He was frequently coughing up blood. And Bailey took him to the operation. He made an incision in the chest. He spread the ribs. He entered the pericardial sac. He pre-placed his ring of sutures and made an incision and stuck his finger in the hole. And now he tries to tighten the suture around his finger to limit the blood loss. And unfortunately, the suture tears through the cardiac muscle and pulls out. And he's sitting there with one finger in the heart and one finger holding a string. And the blood is gushing, filling up his hole. He's working furiously, yet in vain. And in a few minutes, his patient's dead. He didn't even get a chance to try his finger thing in the heart. Undeterred, I told you this guy was supremely confident. He tried in another patient. This time, he got his finger in the heart and he poked it through the mitral valve. And believe it or not, the patient actually survived the surgery, but died within 48 hours. For these two deaths, Bailey's operating privileges at Hahnemann Hospital in Philadelphia were revoked. The chief of cardiology told him, "It is my Christian duty not to permit you to perform any more such homicidal operations." To this, Bailey retorted, "It is my Christian duty to perfect this operation. Nothing could be worse than what mitral stenosis does to people." Bailey next took his operation to Wilmington Memorial Hospital in nearby Delaware. There he operated on another patient, this time his third patient. He succeeded in getting his finger in the heart and tried to poke around and separate the mitral valve leaflets, but he was too forceful. He was too aggressive. He pulled away the mitral valve leaflets. And if you can believe it, he actually made mitral stenosis worse. How could you possibly do that? He basically tore away the mitral valve leaflets, so there was basically open communication between the left atrium and the left ventricle, and all the blood in the left ventricle started going backwards into the left atrium. He had converted mitral stenosis into mitral insufficiency. Now he's 0 for 3. This patient also died. In the aftermath, Wilmington Memorial also revoked his privileges, and he basically, people started murmuring behind his back and bad-mouthing him, and he was basically nicknamed the Butcher in circles in the hospital. At this point, I can tell you the surgeon who continues on this tack is either supremely arrogant, which he probably was, or believes so strongly in the rightness of what they're doing that they are willing to endure setbacks and ridicule and deaths to see it done. You know, As a surgeon myself, I can tell you there's certainly many times when I've tried Hail Mary operations. These always seemed somewhat justified because in my case, they're in eyes that are legally blind or going blind. So there's almost like you've got nothing to lose. But I can tell you, unless it's like in a totally improvisational situation like in trauma, I have never tried a technique or operation that has never been done before, or certainly nothing that my peers think is insane. Like to do that, I think I'd have to be either a genius or a madman. And I don't think I'm either. But let's hope Charles Bailey is a genius because he is not going to give up. He still has operating privileges at 2 Philadelphia hospitals, Philadelphia General and Episcopal Hospital. But the problem is word of his failures is spreading. He's worried he might have only one more chance to attempt this operation before these institutions ban him as well. So to maximize his chance of success, he decides to schedule 2 operations on the same day. One in the morning at Philadelphia General and one in the afternoon at Episcopal. That way, even if his first patient dies, he reasons he still will be able to rush across town and start the second operation before someone tries to stop him. This is crazy, you know. He knows that if both patients die, he's likely finished because at that point, there'll basically be like no hospital willing to accept him. In this day and age, I cannot imagine risking one's career in this way. It's just mind-boggling. So the first patient at Philadelphia General in the morning dies on the table. He's 0 for 4. No doubt feeling the stress and gravity of the moment, he drives over to Episcopal Hospital where he's going to operate on a 24-year-old housewife named Constance Warner. This woman, her rheumatic fever had led to such severe heart failure that she could barely move. You know, she was unable to care for her young child, and she'd been hospitalized many times. This time, to Bailey's relief, the operation seemed to go well. He got his finger inside the heart. He opened up the mitral valve. No major hemorrhaging occurred. The patient survived. He went to check on her the next day. She was still alive. Great sign. The next day, was her breathing a little better? By the 4th day, she was walking. It worked. It was amazing. Bailey was elated. His reputation was instantly resurrected. He broadcast news of his success. I'm the greatest. He took the patient personally on a 1,000-mile train ride to Chicago to parade her in front of a big medical meeting, just to show everybody, look what I did. He was a hero. But meanwhile, I haven't really told you what Dwight Harkin's been up to all this time in Boston. He's also been trying to do a similar surgery many times. 6 days after Bailey's first successful operation, Harkin had his first successful case. Before that, he had tried the operation on 6 patients, and all 6 died. At that point, the worldwide success of this operation was 2 out of 12. After the death of one of those patients, Harkin returned home despondent. That evening, there was a knock at the door. The caller was a woman who handed over a sealed envelope. It was a letter from the dead patient. The woman was a friend of the patient who had died, and the patient had made her promise to deliver this letter if she didn't survive. Harkin opened the letter. It said, "Dear Dr. Harkin, thanks for the chance. A small portion of my estate has been left to see that this doesn't happen again." Can you imagine receiving a note like that? If there are any doctors in the audience, I hope to God you never get one, and I pray I never get one. A patient writing you from the grave. But then think about what it was like to write this letter, to pen this letter as a patient, agreeing to go into an operation that you knew had never been successfully performed in the history of the world. And I think that simply illustrates the sense of desperation that both the surgeon and patient must have felt when facing this hopeless diagnosis. You know, Dwight Harkin and Charles Bailey were pioneers of cardiac surgery, but they failed far more often than they succeeded. And to persist in the face of so many deaths and heartbreaking setbacks and you know, took supreme courage, self-confidence, and the ability to bounce back after heartbreaking disappointments. But remember, before them, the heart was not even contemplated as a thing you could operate on and perform beneficial operations on. And because of them, the heart became a viable surgical target And that opened the floodgates. These successes, these little operations I've told you, suddenly got everybody excited that things we could operate on the heart. And within 10 years, they had invented the heart-lung machine, which stills the heart so that we can perform proper operations. Shortly thereafter, the first coronary artery bypass surgery was performed in there, after the heart transplant in the late 60s. And, these guys, this is a cover of Time magazine in 1957. Charles Bailey was known at the time. I've given this talk to large audiences with many illustrious and well-educated people, and only once has anyone ever heard of Charles Bailey before. In the question and answer, if you've ever heard of him before, please tell me. That person was a cardiac surgeon who had been a retired cardiac surgeon. And how much more I always think to myself, do people like Harkin and Bailey deserve to be known than the people we put on pedestals today, like athletes and celebrities and movie stars. These people changed the world, but very few people remember them. And that was that. As an author, for this book, Masters of Medicine, it's really was one of my primary motivations in sharing their stories, to make these people who aren't well known but deserve to be, and share their more well known among readers. So I'd like to now move on to briefly one more tale from World War II. And this story starts with the Allied invasion of Italy in 1943. So if you recall, the Allies had, successfully invaded North Africa, and they wanted to get into Europe. So they thought the soft underbelly of Europe would be the most effective place to start. And they invaded in September of 1943. And to their delight, the Italian government pretty much immediately surrendered. And that was great, except that if they were hoping that the Italian allies, the Germans, were going to give up their firm hold on Italy, they were sadly mistaken. Despite the loss of their Italian allies, the Germans put up firm resistance. And by December of 43, the Germans had established a very strong defensive line just south of Rome, across the width of Italy. So the Allies were rushing men and supplies into southern Italy to try to keep there and strengthen their first toehold into Europe. And there's a port called Bari here in the southeastern Italy, and they were using this port a great deal. This anchorage was enclosed by an impressive mile-long jetty. You can see this in the satellite photo. And the purpose of this jetty was to kind of serve as a breakwater and pier, but also it reduced the harbor's entrance to a relatively small opening. And during this time, this harbor was full of Allied ships. We're talking of, oil tankers, patrol torpedo boats, various smaller crafts. These ships were full of ammunition and supplies. They were so tightly packed that some ship holes touched. And sometimes the port was so busy, the ships were literally waiting 5 days to unload their cargoes. This is just a wartime photo of part of the harbor side, so you can see what it was like. Now, to speed the unloading of so many ships, the British, who were in charge of this area, basically suspended the usual blackout orders. They believed the Luftwaffe was so severely depleted that the odds of an enemy attack were remote. They neglected to put up much air defense. There was only one anti-aircraft battery that defended the city. So they were kind of negligent, and they were gravely mistaken about the Luftwaffe. Albert Kesselring was in command of the Nazi troops, the German troops in Italy. He realized he had an incredible opportunity here, and he summoned all available warplanes from across Italy and northern Italy and ordered them to attack Bari at dusk. 105 bombers heeded the call. The attack commenced at 7:25 p.m. and lasted only 20 minutes. Rarely has a fleet of ships ever been caught so unprepared and undefended. The German bombs set off multiple explosions amongst the closely anchored ships laden with fuel and ammunition. Men leapt from these burning ships into the frigid Adriatic waters. Some were rescued, freezing cold and covered with oil. The total number of dead, counting both sailors and civilians, exceeded 1,000. And in all, 17 ships were sunk and 8 were badly damaged. In the army, they started calling this attack the Second Pearl Harbor. And Bari Harbor would be out of action for 3 months. So I love these newsreels because, from the war, and they're so interesting. So I have a 60-second newsreel just to give you an idea, a little bit of what it was like in Bari.
Sensor clearance now releases these pictures of a damaging raid made by enemy aircraft on the port of Bari on the Italian Adriatic coast. A low-level night attack which claimed 1,000 casualties. The heavy death toll was caused by the explosion of 2 ammunition ships hit by German bombs. In all, 17 Allied ships were lost in the disaster. Flames spread through the docks in an uncontrolled blaze. Aviation spirit and high explosives causing one of the worst disasters since Pearl Harbor. Most of the shipping, whose cargo was to supply the 8th Army, was destroyed by 2 separate blasts from the exploding ammunition ships. Some of the vessels remained burning for a week. The disaster precipitated an immediate inquiry into the ineffective defenses covering the port.
Oop. Okay, great. So I hope you like that. You know, this was a complete disaster, an unmitigated disaster, and it would really be hard to imagine matters growing even worse for the Allies. But believe it or not, they did. In the midst of the attack, wounded men and terrified civilians running for cover noticed a peculiar smell in the air. It smelled like garlic or maybe like mustard, and it lay heavily across the harbor. No one knew what to make of it. And the reason was top secret, okay? One American Liberty ship called the John Harvey. This is a different Liberty ship, a photo of a Liberty ship. It looked like this. This is a different ship. But the John Harvey held, believe it or not, a secret cargo of 2,000 mustard gas bombs, chemical weapons, each weighed about 60 to 70 pounds. An explosion on the John Harvey sent the poison aerosolized into the air and in liquid form spilling into the harbor. In the water, this toxic fluid was mixed with like viscous oil and coated these sailors who were swimming for their lives amidst flames and explosions. And a poisonous cloud kind of wafted over the city of Bari. And because the hospitals were inundated with severely injured people, these soldiers who may not have appeared to be as badly hurt at first were kind of left in their soiled clothing or wrapped in blankets for up to a full day sometimes. If the physicians had known they were coated in toxic fluid, they would have recommended they just shed all their clothes and shower immediately, which would have really helped. In all, 628 military personnel were hospitalized with mustard poisoning, with symptoms ranging from extensive chemical burns and blisters to severe conjunctivitis and temporary blindness. And within a month, 83 of them would die. So if you're like me, you immediately ask yourself, why did our guys have poison gas? Well, you know, the Geneva Convention banned the use of poison gas in war, but not the possession of such gas. And the American mustard gas had purportedly been brought to Europe as a precaution, just in case the Germans used it first, so the Allies would have something to retaliate with in kind. But driven by the fear that disclosure of the facts at Bari would prompt a retaliatory German chemical attack, the Allies deliberately tried to cover up the mustard gas disaster. And an army physician named Stuart Alexander was dispatched to Bari to investigate reports of unusual patient symptoms. And without knowing about the mustard gas bombs, his careful investigation deduced that only chemical weapons could explain the constellation of patient findings that he found. An intact bomb casing with American markings was retrieved from the bottom of the harbor, and this had mustard gas in it, confirming his suspicions and implicating the Allies. He noticed, oh, by the way, this is just one page of his top secret report back to the Army about what he'd found in the soldiers who had been victimized by the attack. He noticed a surprising finding among the patients he was taking care of. Their white blood cell counts were extremely low. You know, in med school, you learn that a normal white blood cell count might be 4,500 to 11,000, several thousand per microliter. Some of these patients had white blood cell counts less than 100. That is extremely abnormal. He deduced correctly that mustard gas had harmed the patient's bone marrow, where infection-fighting white blood cells are produced. And this made him wonder if this chemical could be investigated as a potential treatment for cancers related to white blood cell overproduction. He thought to himself, if mustard could do this, what could it do for a person with leukemia or lymphosarcoma? Whereas mustard gas's effect on bone marrow had largely been ignored during World War I and little studied afterwards, now the Bari incident had created and bestowed scientists with a very large case series of human subjects that had been exposed to the toxin and could be carefully studied. Now, back in the US, Alexander's work was noticed by Colonel Cornelius Rhodes, who was the chief of the medical division of the Chemical Warfare Service. And in 1944, Rhodes organized a classified clinical trial of 160 cancer patients who were treated with nitrogen mustard, a derivative of the chemical used in mustard gas. This study showed positive results in patients with lymphoma, and in 1949, the first cancer chemotherapy medication to be approved by the FDA was a form of nitrogen mustard called Mistargin. It would be the vanguard of a new class of chemotherapy drugs called alkylating agents that are still used today. So thanks to largely to the catastrophic disaster at Bari, a new method of combating cancer had been launched. Remember, prior to this, cancer could only be treated by surgery to remove a local tumor or sometimes radiation. There was no way of treating blood cancers or metastases. Now chemotherapy offered a chance to kill cancer wherever it lived. And despite major advances in oncology today, even immunotherapy, which is the hot topic of the day, chemotherapy is still the mainstay of treatments for most major cancers in patients. So this is the first chemotherapy that we got, and it's because of Bari and the Luftwaffe bombing raid there. It's just an incredible story. You know, their medical history is full of these stories. These two stories I've shared with you tonight, they occupy each only 4 pages of my book. There are so many stories that have changed all our lives. So just to sum up briefly, what lessons can we learn from these stories of discovery in World War II? First, necessity is the mother of invention. Without World War II, Dwight Harkin would never have been confronted with the heart wounds that allowed him to experiment and launch the field of cardiac surgery. Second, it takes maverick doctors like Charles Bailey to take chances and sometimes risk their reputations and careers to make a breakthrough that everyone else thinks is impossible or crazy. And finally, we see that when humanity is at its worst in the midst of such catastrophic disasters like world wars, there are still extraordinary examples of human compassion and diligence exemplified by doctors like Stuart Alexander, who was able to think outside the box and recognize a new observation like low white blood cell counts in mustard gas victims and apply it to problems like no one else had ever dreamed of doing before. The only winner in war is medicine, and thank goodness we can be thankful and grateful that even in our darkest hours, there are those among us who rise to the occasion and can inspire each of us to do what is altruistic and honorable and the best in whatever community and circumstance we find ourselves in. Thank you so much for spending some of your evening with me tonight. I love sharing my passion for history and medicine, and I hope you learned something you didn't already know before.
Well, Andrew, thank you so much for giving this riveting presentation and sharing these very inspiring stories. I totally agree with you that there are a lot of these sorts of untold stories that deserve to be celebrated, along with many interesting people that we now know who are commanding our attention.